Explanation: do you ever wonder why a sudden sharp pain in your chest seems to come with a weird sweating spell? You might think it's just anxiety, but for some people the reason is a rare inherited condition called Multiple Endocrine Neoplasia Type 2A, or MEN2A, also known as Sipple Syndrome. In simple words, MEN2A is a family-linked problem that makes tiny tumors grow in several hormone-making organs. These tumors can change the way your body feels, so paying attention to odd symptoms can be the first clue. Explanation: why does MEN2A happen? The short answer is a tiny change mutation in a gene called RET. Think of the RET gene as a traffic light that tells cells when to grow and when to stop. In MEN2A, the light gets stuck on go, so cells keep multiplying and form tumors. This mutation is autosomal dominant, which means if one parent carries the faulty gene, each child has a 50% chance of inheriting it. For example, if grandma had a history of thyroid problems and her son was diagnosed with MEN2A, her grandchildren each have a half chance of getting the same gene, even if they look completely healthy now. What might you notice if you have MEN2A? Neck lump or voice changes. A tumor called medullary thyroid carcinoma often shows up as a small nodule in the neck. Flushing, sweating, rapid heartbeat, caused by a pheochromocytoma, tumor in the adrenal gland that releases extra adrenaline. High blood pressure, another sign of the adrenal tumor. Kidney stones or bone pain, the parathyroid glands may become overactive, raising calcium levels. Imagine you're cooking and suddenly the stove gets way too hot, flushing and fast heartbeat. The kitchen timer keeps ringing, high blood pressure, and the pot starts bubbling over, neck lump. Those kitchen disasters are clues that the endocrine system is out of balance. Explanation: how do doctors find out it's MEN2A and what can they do? Genetic testing. A simple blood or cheek swab test looks for the RET mutation. Blood tests for calcitonin. High levels suggest medullary thyroid cancer. Imaging, ultrasound, CT, MRI helps locate tumors in the thyroid, adrenal glands, and parathyroids. If a mutation is found, treatment focuses on removing the problem before it spreads. Prophylactic, preventive thyroid removal, often done in childhood or early adulthood. Surgery to take out pheochromocytoma after blood pressure is controlled with medication. Monitoring calcium levels and, if needed, surgery for overactive parathyroids. Think of it like a gardener who spots a weed tumor early and pulls it out before it overtakes the whole garden. Can you stop MEN2A from happening? Because the root cause is a genetic mutation, you cannot change the genes you were born with. However, you can prevent the disease from hurting you by family screening, testing relatives as soon as they are old enough, often by age 10. Regular follow-up, yearly blood tests and imaging to catch any new growths early. Early preventive surgery, removing the thyroid before cancer develops can save lives. In other words, while you cannot rewrite the family recipe, you can follow a careful cooking schedule to avoid a burnt dish. What's new in the world of MEN2A? In the past few years, doctors have started using targeted drugs that block the faulty RET protein, such as selpercatinib and pralsetinib. These medicines can shrink tumors that are hard to remove surgically. Researchers are also exploring CRISPR gene editing as a long-term way to repair the RET mutation, though this is still experimental. Lastly, updated guidelines now recommend genetic testing at birth for families known to carry the RET mutation, so treatment can begin before any symptoms appear. These advances are turning MEN2A from a wait-and-see disease into one that can be caught and managed much earlier.